In this video, I will be sharing an example of a situation in which a patient-centered environment was created. An example of a patient-centered environment was during a telephone call I received working as a telehealth triage nurse. My current job requires that I take telephone calls and determine the best course of action for my patients. I acknowledged and considered the patient's culture when I communicated with a patient in a recent phone call who spoke another language other than English. I achieved this by offering the translating services, actively listened to the patient's concern, and speaking in a respectful and empathetic manner to involve the patient in their decision-making. In this scenario, I received a telephone call from a Spanish-speaking patient with complaints of a possible allergic reaction to peanuts that started 15 minutes prior to the call. Patient has a history of having a severe allergic reaction to peanuts in the past and carries an EpiPen. She was eating Thai food and did not realize nuts were in her food as part of the dish. During the initial phone call, she was constantly clearing her throat and reported some difficulty breathing and was not sure if she should go to the hospital or if she can just take Benadryl at home. Since she only spoke Spanish, connecting with a translator was the best approach of care for this patient. Within 5 minutes into the call, the translator was able to convey appropriate information to the patient about informing her husband about the situation, the importance of needing to call 911/EMS for care, the need to call 911/EMS, and how to properly administer the EpiPen appropriately. Even though the call took longer due to the translating service, the patient was provided with an appropriate disposition, and she understood her plan of care. The company I work for recognized that many of its patient population comes from a diverse cultural background and that language barriers is a huge factor in providing efficient care. Language barriers in healthcare lead to miscommunication between staffs and patients. Language barrier reduces patient satisfaction, increases visit time, and increases cost. To overcome this barrier of effectively communicating and provide safe patient care, medical interpreters can help bridge the cultural gap and be a medium for both parties to engage in communication. Also, another vital method to addressing language barrier is to reach out to trained staffs in another language or direct the patient to speak directly to staffs who speaks the same language. Overall, telephonic interpreters remain an efficient way to bridge this gap. By offering translation services, I was able to ensure that my patient was able to fully understand their medical condition, treatment options, and instructions for follow-up care. This helped create a more patient-centered environment by addressing a specific cultural need and improving the overall patient experience.